guys, Dr. Mike here, Oak Brook Medical Group. I'm going to be talking about some neck pain here. A lot of patients coming through with it. It's one of those things that, if you're dealing with neck pain, headaches, numbness and tingling down into the hands, pain down into these traps, and you feel like it's almost into the shoulders, a lot of the times that comes from the neck. So, the same thing as anywhere else. There's a lot of pain points that could be causing that pain. So we kind of want to walk through it and look. So using this x-ray here, I have permission to use it, everything like that. A couple things that we're going to look at. When we talk about the structure of the neck and the way it should look, the first thing you always want to pay attention to when we look at someone from the side here is we should have a smooth C-shaped curve of that neck sitting this way. So you can obviously see with this person, that neck, instead of being C-shaped, has gone perfectly straight. The problem with that is over time, all of that axial load is now going to go straight down into these discs in the lower neck. So a lot of times we have patients come through here and they're like, "Doc, I got neck pain." We take x-rays and the lower part of that neck is degenerating faster than anywhere else. So the patient will look at me and say, "Well, Doc, it's because of my age. That's why my neck's degenerating." It's like, well, it's not really an age thing, because it's degenerating down lower here, but yet all of these bones up here look great, but they're all the same age. So if it was an age-based thing, don't you think that every joint would be degenerating at the same speed? So that tells me something is happening in the lower part of that neck that's forcing those joints to degenerate and break down faster than anywhere else. So that's what we have to figure out. And a lot of the times that'll come from that structure. So to show you guys what that looks like, my fancy tool here, if the spring was the bones and the rubber band is all of these muscles and ligaments and even that spinal cord that runs right behind those bones, when we have that proper curve, see how relaxed everything is? Now, if we go to mimic where that neck's at and how straight it gets, see how tight that rubber band goes? So that's all of this musculature here. The further that head goes forward, which is what that line is, the tighter all of these muscles and ligaments and tendons are going to be on the back of that neck. So as we start to get to degeneration in the lower part of the neck, now we know we're losing that disc space. These dark holes you see right here, those are where those nerves come out. So as that gets smaller, now we're going to have more of that radiating type pain, numbness, and tingling into the hands. So step one, what we want to do to help this patient is reintroduce that curve, get these muscles to relax and really just calm down there. The other thing we look at from the headache standpoint, so this is the very top bone in the neck right there. It kind of looks like the front of an airplane taking off. In a perfect world, I'm going to show you guys behind this door. Normal, this is ideally we want to see really big open spaces back there. So now if we come back to that x-ray, everything's jammed up. So this patient's head's literally stuck in extension. Everything's compressed right here. Brainstem sits right down in there. So all of those nerves come out, wrap up into the head. And that's one of the reasons that you could be getting headaches. Obviously a lot of reasons, but this is structurally speaking, one of the things we're going to pay attention to. So like I said, objective one, we really have to start to reintroduce that curve into the neck, get that muscle to relax, get everything to calm down. And then from the adjustment chiropractic standpoint, we really want to start opening up that space up there to take pressure off of those nerves, get things to relax. So whether you're dealing with numbness, tingling in the hands, headaches, or just neck pain that feels really tight, constantly achy, this is why it's so important to take x-rays so we can break those things down, find out the exact cause of why you're having the pain you're having. But then more importantly, we know exactly what we got to do to get you better so that we can get you guys feeling improved, more mobility, more range of motion, and just flat out enjoying life at a higher level. That's what one of our goals are. So if you guys are dealing with any of those things, call us at that number below, comments below, and we look forward to talking to you guys soon.